Good morning or good afternoon, wherever this YouTube message will reach you. My name is James Cleveland, a teacher in our Connect group of teachers at the Tabernacle, our church in Decatur, just outside of metropolitan Atlanta. I also wish to introduce you to Brother Derek Lewis, who is a member of our class and the technician in charge of setting up our CDs, DVDs, YouTube apparatus for our classes and meetings and so forth. Brother Lewis is joining me today in discussion of a subject we feel that most men hesitate to and avoid the conversation that affects many of us: prostate and cancer. Cancer itself is a pandemic today, with more than 100 types of cancer that affects the human body, all which can be deadly or very devastating if not attended to or handled in a timely manner. Reason for the word pandemic is because just 60 years or so ago, the ratio of getting this problem was 1 out of 50. Now today, in 2017, the ratio is 1 out of 2 men, 1 out of 3 women, and 1 out of 4 will have some problem with cancer in their lifetime. This is the prediction in our America. The figures for death due to this terrible problem was 550,000 in 2016. We will certainly make no attempt to answer all the questions that this subject or topic of prostate cancer, which is too important, too controversial, and broad to confine it to discussion of an hour, or book, or years of study, as it affects each man somewhat differently. Some men will accept the doctor's recommendation without question. My point to make is that this is a decision, a choice, one must make that will definitely impact the quality of our remaining years and very possibly the length of our lives. Make the decision with full understanding exactly what is going on in your body. Now, the treatment choice of options you make about your cure, and cure and treatment is absolutely positively not the same word or the same meaning. And in most cases, you will hear the term coming from your conventional doctor's mouth. The very word cancer can be devastating, can affect you physically, mentally, emotionally, and spiritually if you let it. I simply wish to give my personal point of view after 25 years experience as having the problem. And by no means is this intended to replace another person's choice or his physician's decision for him. Each person may require an individualized protocol. The factors such as your general health, your family longevity, and the specifics of your problem. So, I say this. The number one factor, and I strongly recommend this: don't panic or be panicked into any quick, fast decision, even if your doctor tells you this is it. Get another diagnosis, 2 or 3 options if necessary. Study and research your situation personally. Today is the day of information. We are in the information age. It's not like it was 25 years ago, which I had a gentleman to tell me that he was diagnosed with prostate cancer and the doctor had recommended surgery. I asked, what stage was the cancer? He said in stage 1. I said, hell, that's no time to start a life when there are so many other options. Study your situation personally. Learn every issue on the subject you can, and only then, with your doctor's help, you make the decision on how to handle your situation.
That was beautiful. What are the functions and anatomy of the prostate gland? Many men may not even know.
You're right, Brother Lewis. The prostate gland is essentially for reproduction. It's one of those parts of the body, as you said, many men merely think about or rarely think about until he begins to have problems or concerns. The function, of course, is to add vital nutrients and fluids to the male sperm. That's the function of the prostate gland. The reason could be that under normal circumstances it works fine until you are about 50 or more years old. Then the normal male hormones begin to change. It simply starts to enlarge the prostate gland from the size of a walnut to the size of a lemon.
Where is the prostate located in the body?
Brother Lewis, it sits just below the urinary bladder and the bottom of the pelvis, surrounding the urethra. And when this becomes enlarged, it causes narrowing of the urinary passage and make it increasingly difficult to urinate. The bladder does not empty as it should, and this does not always mean that it's cancerous.
When a doctor recommends surgery, what should we be aware of?
Be certain that you have explored every option. And as I said, from 1, 2, 3, 4, and further opinions or options, certainly there are a number of wonderful, excellent surgeons. But do you know the skill and the record of this person? Think of yourself, your age, your marriage union, and the stage of the cancer prostate problem. Remember, science says that we have 75 miles of veins, arteries, and vocabularies in the adult body, many the size of a hair. Then the nerves in this area all is important to blood flow. One nick of the knife in the wrong area, and you may not see an erection again in life. Think about that.
Wow. What about the importance of diet and nutrition? And how does that affect prostate and cancer?
Well, proper diet and nutrition plays a tremendous role in preventing and killing cancer cells, flushing them out, the dead cells out of the body, period. So it applies to prostate cancer as well. It was a time when it was considered fringe thinking. Today, most major academic and cancer institutions have a very active research program into the role of diet.
What are the studies actually showing?
These studies suggest that a high protein, fat, red meat, dairy products, and junk food stimulate cancerous growth. In general, prostate cancer is less common in countries which has a low-fat diet, such as Japan, China, even in the South American countries, areas where the diet is low in fat. And with many of the men that eat a lot of raw pumpkin seeds, etc., which have the kinds of nutrients that assist in health cancer.
Can you explain for us how high-fat diet stimulates prostate and other cancers?
Yes, Brother Lewis. It serves to activate or otherwise a dominant internal mechanism within a cell own structure that directs the cell to grow without its usual limit and boundaries. It also suggests that excess fat, which cannot be broken down into cholesterol, stimulates the growth of testosterone, like hormones, which stimulates prostate cancer to grow.
Is there anything I can eat that will reduce my chances of cancer?
Yes, it is. But we're coming to the end of this section. Let me answer that in our next segment.